Hi, everyone, and welcome back to Habaita. Today, I am so honored to be joined by Dr. Hila Ben Pazi, who is the CEO of Averto. And Averto is doing some incredible things with regards to strokes. And I understand that you also, Dr. Hila, are a pediatric neurologist, which I'm so excited to talk to you about. I haven't shared this with you, but my husband is a neonatologist. So I am and actually, my brother in law is a pediatric neurologist. So I am somewhat familiar with this area just through osmosis. But welcome to the podcast.
Thank you for inviting me. I'm excited as well.
Great. So can I call you Hila? Is that okay? I always ask doctors first if I can remove the doctor during the podcast out of full respect. Okay, wonderful, Hila. So Hila, maybe you could just tell us a little bit about, your history being a pediatric neurologist and where this idea actually came from.
So, as you mentioned, I'm a pediatric neurologist specializing in movement disorders. That means that I see every day young people coping with disability, and it's frustrating because I see the potential that is lost. And you probably know that once the brain is injured, you can't really fix it.
Yes.
So instead of asking ourselves how to treat disability, I started asking, how do we prevent it? And as you mentioned, stroke is the leading cause of disability in the world. And it is treatable and even avoidable, but only if we catch it in time. So the problem is that by the time we see that the signs and symptoms of stroke, the damage is already there. So I wanted to find a way to detect stroke before the damage happens. And that's how I came to found Avelto.
Okay, so is it related to pediatrics at all, or this is more because I know my daughter is also a paramedic, and the majority in MADA and the majority of the calls that she is on are strokes, very few pediatric cases. So just curious from your perspective.
Yes, exactly. So the vast majority of strokes occur in adults, and actually the 2% who do present in pediatrics are often not treated. And the gap between this actually led to inventing Averto because as a pediatric neurologist, you see stroke in kids and they are not treated and they have disability throughout life and mainly movement disorders. And in adults, you have the potential to treat, but only if you catch them in time. But with time, we're seeing more and more treatments.
Wow.
Yeah.
Okay, so basically what you're saying is that there are cases of pediatric strokes. Is it just that the physicians are not identifying it as a stroke, or is it too late after the symptoms that the actual brain damage has been done?
So the traditional treatment for stroke, can treat stroke with medication and thrombectomy. These are not common ways to treat stroke in kids for a lot of reasons, but also the brain in kids is more plastic. Today we see more and more strokes in kids being treated, but the main line of therapy is still the adults.
Maybe you can just explain, how does your solution, how does it work? When do you identify that it's needed? Maybe you can just walk us through that.
Yeah, so the main pain in stroke is the underdetection. And surprisingly, we see that stroke is underdetected in the hospital, where treatment is really literally right around the corner.
Wow.
And you might think that strokes inside the hospitals are treated faster, but actually it works the other way around. 20% of strokes happen in the hospital, and they are diagnosed even later than at home, resulting in much more morbidity and mortality. And why? Just because these patients are usually sedated, sleeping, confused, not in their normal environment, and they cannot tell you when something is wrong. So let's take let's say a typical patient, okay? Someone is coming into cardiac surgery, okay? And this person usually takes medication to prevent stroke, but this medication must be stopped before surgery, right? Because otherwise you risk bleeding. And right after the surgery, when after messing with the heart, and the debris can go anywhere around the body. And after the surgery, when strokes, when they happen usually immediately after surgery. And this is the time exactly that the people are sedated for 6 to 8 hours. And this is exactly the window of opportunity. So often the strokes happen when the patient cannot demonstrate any clinical symptoms. And by the time they wake up, it's too late.
It's so crazy that you said that, because my father literally just went through that surgery for his heart, and he had to stop his blood thinners, obviously before, which is why they wanted to, give it a few days before they did the surgery. And he literally just went through that. So thank God he did not have a stroke, but I could totally understand. So is it more that the surgeons and the recovery team, because usually you're in the recovery room and then you're moved to your room. So is it the surgeons and the recovery team that need to be educated to look for it, or how do you solve that?
It's not about education, you see, but when a patient is sedated and you walk into the ICU, you see automated monitoring, right? You see the EKG, the blood pressure, the saturation, at least 4 or 5 parameters monitoring your heart. Then you have the lung monitor. But if you have noticed, there's no monitor for the brain. So the patient is sedated, and how would you be able to detect that without any monitor? So it's inconceivable that we're not monitoring this.
Okay, so your solution then is a monitor for the brain that then gets attached post-surgery, or at any time that a patient that, is susceptible to stroke and they're admitted, they would be connected to this machine that will monitor their brain. Wow.
Yeah, exactly. Actually, we don't monitor the brain. We monitor the neck, the carotid artery, which actually supplies blood to the brain. And when there is an occlusion, it's really like plumbing, there is a rise in pressure on one side, and we can detect this even before the first neuron dies. So that's
So basically the machine will then sound off, there's alarms, and the team will be notified, okay, this is happening, and they can rush, and what can they do at that point in order to prevent the stroke?
Yeah, so basically we monitor the neck pressure in both sides, and when there is a severe asymmetry, we notify the team, and according to the patient, they can decide what to do. They sometimes can stop sedation and then take to imaging, or for example, we have a lot of cases that people come into the hospital and they're monitored for a stroke, but at some point they fall asleep, right? Even though they have a high risk. So if a patient is sleeping and, we see a vast asymmetry between the neck side, they can simply wake the patient up and examine.
So these are like pre-stroke symptoms that you're monitoring.
Exactly.
And so this wouldn't really be relevant for the ambulance. Let's say if somebody is calling already that there's an emergency and the paramedics come, would that be helpful for the paramedic team as well to have that on the ambulance?
Yeah, so in the ambulance, usually they try to assess for a clear-cut case of, let's say, if one side of the body isn't moving and it's clear that you have a stroke, a large stroke. I don't think we have added values, but sometimes you have very iffy cases like a patient is confused, or maybe it's not stable and you're not sure if it's a stroke or not, and this can actually help with the triage. Today we're not focused on that arena, but of course it can bring added value to that arena as well.
That's amazing. So right now, again, this is basically hardware that's installed, and you would need to have many within the hospitals, right, to connect to each individual, to connect to each patient. So where have you deployed this so far?
So we are pre-revenue, okay? We have completed our clinical studies that detected in 17 patients very good results, 100% sensitivity and 86% specificity, detecting large vessel occlusions. So we had to decide what to do next. Obviously, 17 patients are not something we can shout out loud, we can detect stroke. We
Right.
have to enlarge the number to 100 patients at least. But the point is, we already think that we can provide some monitoring, providing soft tissue sensing. So this is when we decided to actually commercialize our first device, pursuing FDA Class 1 registration, and we can start commercializing it for very early adopters. So for doctors who really are intrigued by this notion and want to test this, it's going to be easy for them to implement this. So that's case.
Explain to me and just a little bit about the process if you want to install this kind of technology in hospitals. Does it have to go through a specific approval process in different countries? How does that work?
So it depends on the country. You have to have a local registration, at least. For example, in the US, it's FDA. In Europe, it's CE. In Israel, it's called AMAR. And once you have it, any doctor or hospital can purchase the device and use it. If there isn't a registration, you need to do it in clinical studies. However, our company is always, and companies are always interested in retrieving data and doing clinical studies. So we are combining the two. So real world use, okay, and also clinical studies. So the combination of both is very common. It's called pre-market and post-market.
Yeah. So what's involved in a registration? I'm sure it's not just going and registering. It's a process. It sounds simple, but I'm sure it's a whole process.
Yes, it's a whole process. It's very lengthy. Yeah, I can just walk you through it. There are certain standards you have to follow, and engineering and testing and completing the whole safety. So basically, there's a whole safety profile you have to be tested for. And we do it here it's called Mechon Hermon. And basically, checking that, all the labels are in place and so on. And basically that you're not doing any harm, okay? Yeah. That's basically, regulation is about the balance between doing good and avoiding harm. And basically, when you are a low-class registration, so you're saying that it's not harmful. So basically, an external device that is indicating something. For example, let's look at a thermometer, right? So the thermometer, you check your temperature, and it says 39, right? It doesn't say take antibiotics. It doesn't say take antibiotics.
Right.
It says, that you had yesterday 37 degrees, and now you have 39 degrees. And taking in account all the clinical picture, you can decide whether you want to do this or not. For example, if the thermometer shows 39 and you are feeling okay, you're actually, going to throw it away. Or if you feel horrible and, and the thermometer is not working. So there's always a clinical judgment. This is how we treat our Amit 301 device. It gives you information and you have to interpret it according to the clinical context.
Got it. Okay. And how is it connected to the patient?
So it's basically an arc sitting on the neck.
Okay.
And the sensors sit upon the soft tissue over the carotid artery. So they sense what is going on in terms of arteries and veins, what's happening here in this area.
So it's nothing that's actually invasive. It's actually just
it's not invasive, and it's not a direct measure of the carotid artery. So it's a reflection of pressure, soft tissue changes that occur in this area. Okay, so it's not a direct carotid measurement.
Yeah, got it. Okay. Wow. So tell me what your dream and your vision is with this, because obviously this has the potential to not only save lives, because obviously stroke results many times, in death, but like you said, in limiting the motor movements and reducing their quality of life. So, what is your dream with this in terms of bringing it to the world, in terms of what you feel it can do?
Yeah, so this is really an impact, okay? We would like to impact. So, speaking about disability, stroke is the leading cause of disability, right? And if you want to, so we know how to increase life longevity, right? So longevity is a big deal. However, today with increased longevity, we sort of are stuck with the quality of life during the end of life. And most people don't want to end their life using a wheelchair and dependent and losing their independence. And so I think the main thing we want to see is preventing the disability, some of the physical disability associated with the stroke towards the end of life.
It's amazing. So, I'm just really curious, being married to a pediatrician as well. How do you come up with this amazing idea as a doctor and then say, okay, I'm going to build a monitor? How do you process?
So it's a bit of a story. I'll try to make it short. Life happens, when you're planning it. So I dealt with pediatric movement disorders, which mainly, is about disability in kids. And these kids had difficulty coming into clinic. So in 2006, I started doing telemedicine, and actually I founded the first teleneurology company here in Israel. It's called Neurokan. And I went around and tried to convince everyone how great teleneurology is. And giving these talks, I demonstrated how telestroke, which is using videos to treat stroke, really made an impact. And I was speaking about how this raised the treatment from 5% to 15%. And then one day, an engineer said, well, what about the 85%? I said, well, you can't see it, you can't treat it. So he said, you doctors are so stupid. How come in the era that, you have autonomous cars driving, you still detect stroke like in the medieval ages? Nothing changed in the past 200 years. And I said, yes, it's not my calling, and, I'm a pediatrician, and so on and so forth. And then I actually returned from this program, it's called Mirage, from LA, with a person who was an engineer, and his mom had a stroke that wasn't detected. And for 19 hours straight, he lectured me about sensors. And at the end of the flight, I realized that we are stupid. We are stupid. And he said, I'll challenge you. You go over the literature and you find the physiological measure. It doesn't make sense that we can't sense stroke, and I'll find the sensors. So I went over the literature. I didn't find anything. I was about to give up about after 2 months, and I had a plumbing issue and in my sink.
Okay.
And I thought, I'm not approaching stroke in the right way, because stroke, before it becomes a neurological issue, it's a plumbing issue. Mm-hmm. And we're not very good in neurology. I'm saying this as a neurologist. We really don't understand totally how the brain functions. But in terms of plumbing, we're very, very good in medicine. We have the sensors, we have the knowledge, we have the brain from that.
So then did you work? Okay, so first of all, that's a great story that this concept was actually cooked on a flight from LA to Tel Aviv.
Exactly.
And then even more solidified by your kitchen sink, which is a great story. And then did you reach out to this engineer and say, let's do this together?
Yes. And he was supposed to, yes. He's actually working on a different project. Okay. But he sort of pointed out to the next step and the sensors. It wasn't that easy. I mean, we thought, okay, we'll just find sensors and everything's going to be okay. But it took a while to find the right sensors. It's not that easy, but we did it.
What was that because I know also, just as a founder and an entrepreneur, and especially when you're a doctor, and I know because I'm the founder and entrepreneur and he's not, my husband, so I can just imagine what that process was like for you. So how did you go about testing those sensors and seeing if they were really the right ones for you?
So at first we got some sensors for blood pressure in
Okay.
neonates from a friend of mine, Zena from Stanford. She has this amazing blood pressure cuffs for neonates, and we used it on rats. And we wanted to see if rats, when we have a stroke in rats, we can detect this through the carotid artery. And we just placed these neonatal pressure sensors on the rats, and we found this. We found changes. So that's where we started. But then it evolved.
Yeah,
To
sure.
find better pressure sensors and whatever. And a neonatal hand and arm is not an adult neck and is not a young rat, so we had to adjust.
So was it about going around to different sensor manufacturers? Like, how did you go about?
Yeah, so when we looked for sensors, there were 7 million pressure sensors in the world. So people helped us, engineers, we had subcontractors choosing about 3 sensors, and then we had to make other adjustments to adjust this for the neck pressure. And eventually we came up with our unique pressures sensors. It took time.
How long did that, I was going to say, how long did that process take?
Wow. We had 3 iterations. So we had Verto. Now we're on third iteration. We started off in 2022. So it took us 4 years and 3 iterations to reach where we are.
Wow, that's unbelievable. So during this time, were you still working as a pediatric neurologist, or did you leave and fully devote your time to this?
Yeah, so since 2022, I'm full-time CEO, and I do clinic like twice a month.
Okay, like I think that's obviously still important, right? For you to, just, to be in touch with the patients and even be able to, be on top of all the new changing things that are happening. But that's unbelievable. So when you said, okay, that's it, I'm leaving my full-time job right now and I'm going to start this. Did you then go after investors to get funded? What was that process like?
So in Israel, we have the Israeli Innovation Authority, and they're very, very geared into bioconvergence, which means
Yes.
the biology and physics combined together. So we were heavily supported by them, and their condition was for me taking a leave from medicine and committing myself to the company. So that was the first investments. And of course, as a company, we started with friends and families, and then, we have now more investors that are in the field, and now we're in the seed round.
Amazing. I mean, I could just imagine because going through the whole process, my husband and I got married when he was in second year med school. So going through medical school, residency, fellowship, all of that, and then deciding, okay, I'm going to take a leap of faith and leave practicing medicine is massive. I don't think people can appreciate, the amount of time that goes into building what you built. But I'm sure in your minds you're thinking, well, I can help so many more people, live better lives if I were to do this versus me being able to treat people, in the hospital or the clinic with however many people I personally can treat versus how many people this innovative technology can treat. So I totally understand why you did that. And it's very rare that you'll find doctors that are specialists that will do this and like really kol hakavod. It's unbelievable. And I can't wait for, to watch this grow and to hear from hospitals that are using it and just coming out with the data around how much it's helped prevent stroke and, help people live, like you said, end of life, but higher quality of life. That's unbelievable. So, Dr. Hila, thank you so much for joining me today. It was such an honor and a
May
pleasure.
I add
Yes,
something
please.
very important? You can place it wherever you want. We were the first company to go through the Next October project. Do you know what Next October
No,
is?
I sounds familiar, but maybe just explain
Okay.
it.
So Izhar and Ila Shai, the Shai family, when they lost their son Yaron Nuni on October 7th, they decided that they're going to commemorate all the people who were murdered them by growth. And their saying is they came to kill and we are saving lives. And we were the first company that selected the person we wanted to commemorate, and we chose the brave Amit Man paramedic, who saved lives and did whatever she could, even in her last moments, and using what she can. And this legacy of saving lives with whatever you can now is something we greatly appreciate and embrace, and this guides us through all our decisions. So, for example, now after the first clinical study, we could choose whether to continue clinical studies or to go fully commercializing. And so we commercialized the first device after Amit. It's called Amit 301.
I'm like, I have shivers, Hila, because Amit actually trained my daughter. So
Amazing. We didn't know her. Yeah.
it was unbelievable because she was in the south and my daughter was training to be a paramedic in the center of the country. She's in Herzliya, Kfar Saba area. And it was Sukkot, before they have their massive paramedic test, which is really big. And Amit decided during her Chol Hamoed Sukkot to give these girls a lesson to help them pass because it was really stressful. And she wasn't their instructor, and she did it. She didn't even know them. And she got on the wall with these girls, and she spent a long time with them answering all their questions and giving them this like session. And I think they all passed. And they all passed and at the ceremony of Mada, they, dedicated a lot to her. She was instrumental, first of all the paramedics from the South during that time ended up going into the center with my daughter in the center of the country to continue the training. So they all trained under Amit, and it was just so, when you said that, I literally got the chills, and it's like unbelievable. She was such an amazing person. Amazing. And what an honor to be able to dedicate this to her. And as a paramedic, like I said, their stroke is I think my daughter says heart attack and stroke are the number 1 and 2 calls that she, goes to. So what an honor to dedicate this to Amit. And I never heard of that project. It's unbelievable. So maybe just explain for 1 minute, just what this project, they fund you, or how does that work?
Yeah, so what happens, actually, it's very important for listeners. Shira, this podcast will probably reach a lot of startups, and whoever is not commemorating, you can reach out to next October. They have a website, and each startup gets, coupled with, they can choose who to commemorate, and it's very unique. Every startup, finds the way of commemorization. Sorry, let's do this again. And the way, today in Israel, we have to really shine the light and make an impact. And for me personally, commemorating Amit is not only about looking at the set of values. You have to make a lot of decisions in startup, but it's also about enabling Amit to continue saving lives even after her death. So I'm sure she would wish that. Her family always says that she was the first to embrace technology. She was an early adapter. She was all about technology, innovation, saving life, and compassion. And so it would be an honor for us to enable this.
Well, first of all, thank you so much for sharing that. First of all, about Amit, I mean, she was just such an unbelievable person, and no doubt she would be so proud to be commemorated with what you're building, which is unbelievable. But for other startups to hear that this is an option, is it only startups in the medical space?
No, not at all. And also, I would say that if there are other American or other startups around the world, I think next October would appreciate, there were a lot of people who were not necessarily Israeli citizens, and we need to commemorate the good of these people.
Absolutely. So how do you go about associating your company then with Amit? Where is that published? How does that look like for you?
So for each company, it's different. Okay. For us, our main focus is through the emergency care and saving lives and naming and telling her story and doing this fast, as we do in emergency medicine. So not what I'm going to tell you a story. You
Okay.
can decide whether.
Okay,
So
good.
I remember one day sitting with Rachel, Amit's mom, and Rachel said, "I don't understand. It works, right? So why aren't you in the market?" And I said, there's regulation, it's a process. I don't understand. If it saves life, you have to be in the market. So if we had any dilemma, Rachel really reflected what is needed here. And I'm sure that if Amit was with us, she would say the exact same thing.
Yalla, get it in the market.
Yalla, get it in the market, take the risk, and go ahead and do this and save lives.
So in a way, Amit and Amit's family really guided you to make the decision to commercialize faster than just doing further trials, etc.
Yeah, they gave, it was like the final push there.
It was the push. It was the push. Yes. That's unbelievable. Wow. What a fantastic story. And I'm going to definitely post about the organization as well when I post this podcast. So if anyone would like to contact them and reach out and connect with a family of a murdered victim from October 7th, that would just be, such a light. And just like, you're dedicated to, saving and choosing life over death, which I think is a big part of our nation. That's the exact reason that I started this podcast, was really to focus on the most amazing and incredible Israeli innovation that every single interview that I have, every single one, there's not one company that's saying, oh, we're keeping it here in Israel. Everyone is, we are bringing it to the world. And what a light we are. And, it's just, we have to fight this negative media that is portraying us so inaccurately. And I think it's so important for us to show accurately the amazing good and the healing that this, and not just healing, but, we're in every chip that's in every computer. It's unbelievable where the innovation goes to and how it helps the world. And that is our mission, to help the world. So thank you so much, Hila. It was such an honor to meet you. And I really enjoyed our conversation.
Thank you, Shira. Thank you.